Okay, everyone, for hour two, I want to play you an interview I did recently with Kobi Blumenfeld-Gantz. Kobi is the CEO of Chapter, a new way to sign up for Medicare. And honestly, I was really impressed. Inspired by his parents' nightmare experience signing up, I learned a lot about what it means to enroll in Medicare. I think a lot of you in this audience should listen carefully. It's really interesting. And we cover MAHA, insurance, and more, including if you are enrolling in Medicare or already enrolled, he might be able to help you. I asked all the tough questions. I think you'll really enjoy it. Okay, everybody, welcome to this amazing conversation we have with you all about askchapter.com. Did I get that right, Kobi?
Great.
And joining us now is Kobi Blumenfeld-Gantz. Did I say that correctly?
Yes.
Okay, welcome to the program. It is. I hear such amazing things about you from Vivek and other people, and so glad you're here. Introduce yourself to our audience.
Thank you so much for having me. It's a pleasure to be here. I started Chapter a few years ago. Before that, had worked in software, working with the government, and have spent a lot of time looking at how large data sets can be used to help people, how the government can be more efficient, and there's a lot to explore there in using information and providing better services to people, and how we can create systems that help people with much better incentives to create better services for Americans.
So you decided to start askchapter.com. First, tell everybody what it is, and then the why. So, or you could, whichever way you want to do it.
Yeah.
Tell the story, because it's a personal experience that drove you to this.
Yeah. So I was very fortunate to grow up with my grandfather, living with my parents and me when I was in high school. He was very healthy, mentally sharp, and with it. But just as a function of his generation, he didn't really have access to the technology of the day and didn't really know how to interact with others in a meaningful way. And it wasn't because he was a Luddite. In fact, it was the opposite. He would take radios apart. He was very, very technical for technology of his day. And he was fairly isolated in our home, and I always thought that was just kind of crazy, that we didn't have a good way to engage our elders and our seniors in productive life after this thing we call retirement. Of course, I didn't do anything with that at the time. I went to college, I went to grad school, worked in software for a long time. And then as my parents were getting older and going through a similar process, I observed them navigating Medicare and retirement writ large. And just saw how the system is really rigged against our elders when they're dealing with Medicare. And it was just such a challenging experience for them. They were working with a local Medicare advisor who was maybe well-intentioned, but didn't have the data or the tools to be effective. And they frankly got screwed. They were far overpaying for a plan that they didn't need. And I just looked at the industry and thought it was kind of crazy.
So excuse my ignorance. So
yeah.
So there's Medicare advisors. So is it like open enrollment? I mean, I've never dealt with Medicare. How does this process work, and who set it up?
Yeah, so the history of Medicare is pretty interesting. Goes back to LBJ with Social Security Act and Medicare, and we largely have a system that's been Frankenstein together over the past many, many decades. And there are many types of Medicare. It's not just this one, it's not one Medicare plan. Part A, B, C, D, all these letters, alphabet soup of Medicare. And most people assume that it's just automatic, that you turn 65 or you retire and you get Medicare. And that's, fortunately or unfortunately, just not how it works. And so there's a whole industry of people out there who are there to support seniors in navigating this process. But as we're seeing with some of the DOJ investigations now into a lot of the industry players, it's really a massive scam. Pretty much every American who's working with a Medicare advisor today is not getting the best guidance for their needs. That's 70 million people.
But who are these Medicare advisors? Are they private actors?
Yeah.
Okay, so they're companies.
Yeah, think of it as like a real estate agent.
Okay.
So you have
that's a good compare. Okay,
it's a real estate agent analog. Many of whom are kind of doing this as a side hustle, and so not all are malicious at all, but most to all don't have the data or the really expertise to be effective.
So let's say a couple. What age are you eligible, Megan? 65?
65.
Okay. So they both turn 65. They call a Medicare advisor, or there's all these hotlines, right?
Yeah.
That they advertise on TV. Yeah. I drone out when they do that, right? But they say, okay, call your Medicare advisor hotline, whatever. You call it. You're like enlisting a real estate agent. What is the conventional or the most the most common experience that he has?
So the way it works is most Medicare advisors are paid a lot more in terms of commission for one type of plan. It's called a Medicare Advantage plan. That's one of the two sort of types of Medicare plans you can go down. And because they're paid more by these Medicare Advantage plans, they're going to push a subset of Medicare plans on the user. In the same way you might have an insurance agent push plans of any type, whether it's auto insurance, life insurance, whatever it is. But when you're dealing with someone's health and something that's so foundational, and also let's remember, it's not a welfare program. Medicare is a program that we've all been paying into. We pay into as part of Medicare payroll tax our entire lives. And so it's something people have paid into and deserve and have really earned through their whole careers. They're being sold plans that are really just at the what's better for the Medicare advisor, for the Medicare broker. It's not what's better for the customer. And really, who is the customer here?
But so do people have to co-pay on Medicare then? I mean, who's paying for Medicare Advantage versus a lower plan? The senior themselves? I thought Medicare is largely covered by the government taxpayer.
The short version is there are a lot of costs to the consumer on Medicare, without going into too nitty-gritty detail. But the majority of Americans do sign up for some kind of supplemental coverage, which they do have to pay something for. Sometimes that's in the form of premium, sometimes that's in the form of copay, sometimes it's in the form of paying for prescriptions, whatever it is. And so there are a lot of costs sometimes hidden in the system that can be really hard for people to navigate.
So then where do you guys come in and you help with the three key Medicare decisions: when to enroll, how to get the most value from Medicare, and then also how to keep Medicare working for you. So you're a disruptor, and that's like the favorite word, like, ooh, you're a disruptor. Yeah. How are you disrupting it, and how have you been received by the conventional Medicare lobby?
Yeah. So I am not liked by the Medicare industry.
And that's why you're doing great work.
I appreciate that.
The Medicare cartel is doing a lot of harm.
It's wild. It's wild.
I'm not talking about Medicare itself, the cartel surrounding it.
Yeah, so Medicare as a program is actually beloved. Most people who are on Medicare it is really good health insurance coverage. It's all the things around it. It's really the on-ramp, the accessibility to Medicare that are so challenging and are rife with misincentives. So things that we do to help, first and foremost, it's probably not a surprise to say that health insurance companies are not the most technologically savvy or technologically forward organizations. And so what we do is build a lot of really good technology and improve the data quality. So as an example, if you want to know what your prescriptions are going to cost on a Medicare plan, it's a reasonable thing to ask. There is not a single organization or company in the country other than Chapter, for better or for worse, that can tell you that with precision. And the reason is because we have to integrate tens of billions of records of prescription data to know that answer. It's actually a very hard technical problem. So one is we do a lot of technology in the background so that the senior doesn't have to do all that research. Two is we align incentives, and this is one of, if not the most important. As I was saying, most Medicare brokers just push plans that pay them the most. In fact, the DOJ just unveiled this huge investigation. So
is that illegal to do?
We're about to find out based on how the DOJ investigation. I mean, there's no question that it's unethical. Whether it's illegal, it is a question, and that's what they're litigating now. But at a high level, you have a few big Medicare insurance brokerages were being paid basically volume-based performance programs, saying, "Hey, if you sell 100 more Medicare plans of my policy type this month, we'll pay you, another few $1 million."
So does everyone use a Medicare advisor, or it's just most people? I mean, it's like closing on a house. You don't need a real estate agent. Would you say 60%, 70%?
Roughly half to 60% of people use some kind of Medicare advisor. And the reason is you can't get a different price going direct. So it's actually, there's no incentive not to use a Medicare advisor, and it is very complicated.
But the advisor makes the money from the government then?
The advisor makes the money from the insurance carrier. So the flow of funds is the government pays a health insurance company, United, Aetna, Anthem, whatever.
Got it.
They pay, they are the ones who are paying the Medicare broker.
Got it. And so then you guys come in and you are trying to revolutionize the entire broker relationship, where then people would then use you as a replacement for Medicare advisory. Is that correct?
Yeah. So at our core, we are a Medicare advisory and a retirement advisory, which we can talk about in a few minutes. But we look at every single Medicare option. We take in the needs of each person.
We'll be right back with Kobi Blumenfeld-Gantz, but first I want to tell you guys about Z-Factor. Z-Factor is amazing. Z-Factor goes beyond melatonin, and it uses a combination of 4 natural ingredients to help relax your mind so you fall asleep quicker. No groggy feeling when you wake up. Z-Factor was developed by Relief Factor so you can count on the science behind it. Z-Factor is brought to you by Relief Factor right now. You guys can check it out at relieffactor.com. That is relieffactor.com. Call 1-800-4RELIEF. That is the number 1-800-4RELIEF, or visit relieffactor.com. Better sleep without drugs. See how Z-Factor from Relief Factor can get you the Z's that you want. That is relieffactor.com.